Hey guys, Tony Maritato here. Welcome to the Knee Replacement Support Group YouTube channel. In this video, I'm going to answer the question, do physical therapists make house calls? Now, I'm also going to answer 14 other questions related to house calls, getting therapists to come to your home, whether it's home health or outpatient therapy in the home. I'll explain what those means, what the costs are, everything you need to know if you're having a knee replacement and you're looking for an opportunity to have a therapist come to your home. So let's start with question number one. Do physical therapists come to your home? Absolutely, 100%. Yes, we come to your home. We come in two scenarios. We either come under Part A, Medicare Part A, which is home health coverage. Home health typically requires the patient to be homebound, meaning you can't leave the house, and it requires you also receive nursing care, sometimes occupational therapy, sometimes speech language pathology. But absolutely, a physical therapist can come to your home. Now, if you don't qualify for home health physical therapy, you have the option of outpatient physical therapy in the home. Under Medicare Part B coverage, a physical therapist can come to your home for outpatient services, or you can go to the clinic for outpatient services. And quite frequently, after a total knee replacement, you're not allowed to drive anywhere from 1 to 6 weeks after surgery. So if you don't have somebody who can bring you to an outpatient clinic, you can bring an outpatient therapist into your home, covered by Medicare Part B, and then we'll talk about some other opportunities that Medicare doesn't cover. Question number two. How much does in-home physical therapy cost? So let's look at the three scenarios. In scenario number one, home health physical therapy under Medicare Part A. Medicare covers the cost at 100% of your home health services, but you do pay a Part A premium and there's a Part A deductible. Under Medicare Part B, Medicare covers 80% of the cost of physical therapy. The remaining 20% will either be covered by your supplemental or secondary policy, or you'll be responsible for that 20% out of pocket if you don't have any other coverage besides Medicare Part B. The third option, we'll talk about cash-based physical therapy at the end, but you could also hire a physical therapist and pay direct out of pocket. And in those scenarios, you'll negotiate the cost either per visit, per unit of care, or for an entire episode of care. Different therapists charge different rates when you're not going through a third-party payer like an insurance company. Can outpatient therapy be provided in a home or an office or even a fitness center? So there are Medicare Part B regulations that limit where you can receive outpatient. In other words, if you look at the Medicare guidelines for Part B coverage or home health, you can only receive coverage in your home and you have to be homebound. For Part B, outpatient can be provided in your home, your personal residence, or in an outpatient clinic. Those are the only two locations. But if you choose to go a self-pay route, you can receive physical therapy services at work, in your office. You can receive it at your local fitness center. You can receive it at the local park. You can pretty much receive physical therapy anywhere you desire. And the real benefit of something like that is the fact that if you're, want to get back to work and you want your therapist to come there, check out your ergonomic setup for your desk and your computer and everything that you do, the therapist will be able to do that and specifically tailor your plan of care to meet your specific needs. You will not be getting the same exercises that anybody else will be getting because that therapist has the opportunity to see what it is that you actually do. This is great for individuals who have hobbies, who want to return to sport, who, get out and skydive. There are skydiving physical therapists out there. You can find a therapist who specializes in just about anything you want to do. Number four, what does a home health physical therapist do that is different than an outpatient in the home? So home health physical therapy really is about getting you kind of independent in the home. It ends if you're not homebound, and the abilities and time restrictions on traditional Part A home health therapy is pretty significant. They're really not going to be able to take you out and do the things that you want to do to get you back to the life you were living. An outpatient physical therapist providing services in the home really kind of takes where the home health Part A therapist finishes and brings you out into the community. And the outpatient in the home is typically gonna help you go from, simply surviving, simply being alive and being safe, to actually thriving in your home environment, thriving in the community, getting you back to work, getting you back to sports, get back to doing the things that you love. So question number 5, should you tip a physical therapist? You tip a barber, you tip a licensed massage therapist, but typically no. A gratuity, a tip is not part of receiving physical therapy services. It's not customary to tip a physical therapist. Question number 6, will Medicare pay for in-home physical therapy? So as I mentioned before, absolutely yes. Medicare Part A covers traditional home health therapy, which usually includes nursing services. Medicare Part B covers outpatient therapy, either in the home or in a clinic. Medicare Part C is the Medicare Advantage program, and you'll have to check with your individual policy and the payer to determine if they will pay for outpatient in the home or if you are required to go to an outpatient clinic. How many days? Question number 7. How many days will Medicare pay for physical therapy? Well, if we're talking traditional Medicare Part B, Medicare Part B, outpatient therapy in the home, does not go by the number of days. You and your therapist will sit down on the first session, you'll create a plan of care, you'll establish your goals, what you want to achieve, and then you'll determine with your therapist how long a course of therapy might be. It might be a week, it might be 6 months. You'll determine how many sessions per week. You'll determine if it's going to be a tapering schedule. Maybe you start at 5 sessions a week, and then 3, and then 1, and then discharge. All of that will be established based on your condition, your current level of function, and what your goals are going to be. For Part A, Medicare Part A home health coverage, there's usually a 100-day rule, but that's a completely different situation than we're discussing here. And then, of course, if you're going the self-pay route, you're completely in the driver's seat. You decide how many sessions you want, how long you want therapy to go. Nobody is making decisions because nobody is paying for the service except you. Question number 8, what's the maximum number of house calls Medicare will cover? So under Medicare Part B, there is no actual limit. There's what's known as a financial threshold, and we'll talk about that in just a little bit. But Medicare Part B, outpatient in the home, does not have a number of visits limited per year. So let's get back to this topic when we get to the next section. Okay, question number 9. How many times a week should you go to physical therapy? That again is up to you, up to your condition, and up to your physical therapist. You and the therapist will put together the program, determine how many sessions a week, how long each session is going to last, how long the total plan of care is going to be, what you're going to do after you complete physical therapy, if you're going to transition to an independent program, a wellness program, personal training, performance coaching. There is no limit to the opportunities you have working with your therapist, but you and your therapist are going to make those decisions. When should I stop physical therapy? Question number 10. You stop when you're done. You stop when you're ready. Some patients see me one time, they learn a home exercise program, they learn about their condition, and they're finished. Other patients will see me indefinitely. My longest lasting patient was over 10 years, coming to my clinic, working with me one-on-one for 4 days a week, over a decade. It just completely depends on what your goals are, what your current situation is. And I would say it depends on, are you receiving benefit for the services? That's the main goal. Are you improving? Are you making gains? Or are you slowing the decline? If you have a condition that progressively worsens over time, are you slowing that functional decline and enjoying a higher quality of life? All of these are factors that go into answering the question when you should stop physical therapy. Question number 11. How many physical therapy sessions does insurance cover? So under Medicare Part B, outpatient therapy in the home, there is no session limit. But under Medicare Part C, these are the Medicare Advantage plans. They're managed by United Healthcare, by Humana, by Aetna, MedMutual, and other payers. There may be a limit. Some plans have a 20 visit limit per year. Some plans have a limit per condition. You get so many authorized visits per diagnoses. You have to check your individual policy coverage to determine what's going to be covered and how many sessions are offered. Question number 12, how long does physical therapy last? I've had sessions that last 15 minutes. I've had sessions that last 90 minutes. Again, this is determined between you and your therapist based on the clinical findings that are established at the initial evaluation, based on your medical condition, your complexities, what you hope to achieve, what your goals are going to be. What is a cash-based physical therapist? So let's talk about this for a second. Now, there's other names you can use. There's cash-based physical therapy, there's self-pay physical therapy, direct pay physical therapy, concierge physical therapy. Essentially, these are licensed physical therapists who are not contracted with any third-party payers. They work independently. Quite often, they specialize in a service that isn't covered by insurance carriers, or at least they don't have the flexibility and the freedom to provide you with the level of service an insurance carrier is willing to pay for. So they give you, the patient, the opportunity to say, hey, I'm going to pay for this service out of pocket. I'm not going to go through my insurance. Some cash-based therapists will provide you with the documentation you need to submit a claim to your insurance company for out-of-network coverage. But generally speaking, the term cash-based physical therapy, self-pay physical therapy, direct pay physical therapy, concierge physical therapy are all synonyms, meaning you pay the therapist directly, you don't go through insurance. Question 14, what is a mobile therapist? A mobile PT, mobile OT, mobile SLP. A mobile therapist indicates a physical therapist that is willing to come to your home, to your office, to anywhere you want them to come to work with you at that location. So it could be a clinic, it could be your home, but it could be anywhere else that you want. These are therapists that may or may not have a brick and mortar office that you can also go to, but they have the flexibility and provide the level of service that they will meet you where you are. What's great about this is, as I mentioned earlier, it gives you and the therapist an opportunity to really work on the things that you want to work on so that you can be site specific and your treatment program will reflect what it is that you do. Whether you're cliff diving, skydiving, playing soccer, basketball, taking care of grandkids, gardening, playing golf, tennis, any of those things are available to you when you work with a mobile therapist. And then finally, question 15, do I need a referral for physical therapy under Medicare? So according to Medicare Part B Benefit Policy Manual, a referral, also called an order or a prescription, is not required to start physical therapy. There may be state guidelines that require it, but Medicare Part B itself does not require it. It is recommended because what is required is that you be under the care of a physician or non-physician practitioner, and that provider must sign what's called a plan of care and certify that plan of care. So when you see a physical therapist without an order, a referral, a prescription, that therapist designs a program known as a plan of care. That plan of care will be sent to a physician or non-physician practitioner you're working with to be certified so that Medicare will cover those services. If the plan is not certified, Medicare will not cover, will not reimburse for those services. So guys, those are the 15 questions. The best thing you can do is, if you still have questions following this video, go ahead and post them in the comments below. I'm more than happy to create another one of these videos where I just run down a list of questions, answering them, because the most important thing for me is that you get the answers you're looking for so that you at the end of the day can get the services that you're looking for, the quality of care that you're looking for. You're in the driver's seat. This is your body. You need to make an educated decision. I want you to pick the best possible therapist to help you get to where you want to be. As always, thank you so much. If you haven't subscribed to the channel, please do so, and like this video so that I can produce more content just like this to help you, the patient, get the answers you need. I'll see you on the next video.